Welcome to the Making a Multi-Million-Dollar Med Spa podcast, where we dive into the art and science of building a thriving med spa. I'm your host, Kat Toronto. In this podcast, we're all about empowering medical professionals and entrepreneurs like you with the knowledge, tools, and inspiration needed to elevate your practice to new heights. Whether you're just starting your journey or you're a seasoned expert looking to expand, this is the place where the industry's brightest minds come together to share their secrets to success. So sit back, relax, and get ready to unlock the potential of your med spa with the Making a Multi-Million-Dollar Med Spa podcast. Let's go on this journey together, one success story at a time. Hi, welcome to the Making of a Multi-Million-Dollar Med Spa podcast. I'm Kat Toronto, and I'm so excited to be here with Dr. Beth Hagberg. I met her a number of years ago, and from the moment I met her, I just thought, this woman is full of grace, intelligence, kindness, just such an amazing woman. And little does she know, I've been watching her all along the way. And so I couldn't be more honored than to have you here today. Thank you, Beth, for coming on to the podcast.
Wow. Well, thank you. That was a very beautiful introduction. I didn't know that, and thank you. So The reverse is true. I love watching you and everything that you and Matt do and your enthusiasm, and just been so fun to watch you guys grow.
Well, thank you. I think, one of the things I love about doing this podcast is just connecting with other owners in the industry. And, because I think, every day there's things that we come across that can feel like growing pains, or if you want to call it a pain, just growing. And so it's nice to kind of reach out and to connect with other people to hear like, okay, what have you been through? How'd you get through it? Share your successes and some of your failures too. And so I'm excited for our subscribers to get to know you today.
Oh, thank you.
Yeah. All right. So I'd love to just jump in to, kind of go back a little bit and talk about how you got into the industry, because you were a family practice doctor for 10 to 13 years. Is that right?
Yes, that's correct. Yes.
And so what happened in that journey to make the switch?
Oh, well, I liked family practice. But then both Mark and I, we were in family medicine, and then Mark went to ER medicine, and we have 3 kids. And when they were younger, I decided this is really just not working out very well with both of us coming and going. So I came home for a few years. And then when the youngest one started grade school, I was getting a little antsy and wanted to get back into medicine and just trying to figure out my role. I'd always loved dermatology, and there was a friend of ours who said, well, if you ever want to do derm with me, I'd love to have you. But by that time, he'd already hired somebody else part-time. And then I just started looking into aesthetics. I had done, a couple facials and was starting to get into skincare products. I did a little Botox. Somebody else did it for me before I, was in the industry. And I thought, this is really cool. And then one thing led to the next, and I started looking at lasers, of course, Cyton lasers. And I was just like, I can't believe what these lasers can do, and it will help so many people. So, I just thought I was going to start out really small. I was just going to do it by myself. And then Mark found out how much the laser was, and he's like, maybe I better know how to do this just in case. so
like buy a house.
Yeah, totally. So I think he was a little surprised at the price tag. But anyway, so then I was just going to have this little teeny space, that I was renting in a medical office building. And then I was like, well, we better have a little bit more space. So he kind of worked part-time. He brought in the income. When you first start a business, you pay your employees, you pay your bills, but you don't pay yourself. So it took a couple of years to get us up and going where we felt that, we were making an income, and a few more years after that where he could, join Skin Rejuvenation Clinic full-time. So that was definitely a journey, a lot of hard work. But I'm very, very happy with that decision, and I've loved it. I know when I first started, I was really concerned because in family medicine, part of what I loved about family medicine was getting to know my patients and their families and learning about them and seeing them over and over. And I thought when I first started this that I was going to miss out on that. but I was completely wrong because I see patients over and over. And now that I've been doing this for 20 years, I just, I've gotten to know people patients have been with me for 20 years. So, from the time they get married to have kids and on and on with their lives. And I love that. It's really, really cool.
And so when you came back and opened the clinic and your kids were still young and they were just starting grade school, your youngest.
Yes.
And so you'd mentioned, Mark was still working part-time. And so were you full-time at that time? How did that work?
Yeah, I was full time at the clinic, although, we started out with like 5 patients. Our friends and our family, we had this little
Yeah.
Tupperware box with some charts in it. And so it was not like it was crazy busy. But I was there full time because you never know if somebody wants to come in, you want to be available right away. So yeah, I was there full time. And it was funny, we joke about because I had like this little couch in my office and I thought, well, I'll just be able to take a nap if I need to in the middle of the afternoon. And I probably did that 3 times, so that never
Yeah.
worked out. It
I
was a
read
good
one of I listened to one of those books about, it was like the cappuccino nap where you take a shot of espresso and then you take your
idea.
26-minute nap and then you wake up.
And
And
you're
I mean, I've tried that a couple of times. So it's like, really? I mean, how like that's really going to happen.
No, no, it just doesn't. Too
So
too
what did
busy,
you
too much
start?
going on.
Yeah,
Yep,
what
sorry,
did you
go ahead.
no, 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 no. What did you start out with 20 years ago?
Oh my gosh, I was thinking about that today. It's very interesting how things have changed over time. So at the very beginning, fillers were like rooster tail filler, and you had to do allergy testing before you could inject anybody. And when 2005, I think, was when Restylane first came out, and the only indication was nasolabial folds. And, that's what we did. And if we did a full syringe, we were so happy. We did a syringe of filler and it was great. But, with all the advances of hyaluronics coming out, obviously that has really blossomed and changed. And then we started out with our Cyton laser. One of the first things were your micro laser peels. So that's what we started out doing. And then there was something called 1319. I don't know if you were around during that time for acne scarring. So we did some of those. So well ahead of any profractional halo. It was well before that time. And then Saiton, I heard I was interested in getting some kind of IPL device. And then I knew that Saiton was developing their BBL. So I waited for that, and I'm really happy that I did because that's just such a beautiful treatment. But back in the day, we didn't have a lot. Oh, one thing that we did, we had because we had all this extra space, so to speak. We had one of those folding suntan booths where you could do spray tans.
Oh, yeah.
And we thought, oh, this will be really, something nice to offer our patients because we're telling them not to get tan. So we decided we practice on our kids, our 3 kids. So we got it all set up. And then I sprayed one of them and Mark sprayed one of them. And then our youngest, I sprayed him and Mark said, no, 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 you didn't do that right. He's not dark enough. So we got a second coat. The poor guy, he was so dark, so dark. He went to school the next day. Poor thing. What happened to you, David? What happened? And he goes, I was an experiment gone wrong.
Did you ever see the Friends episode? Where,
No,
oh my,
no.
I'm gonna send you that link. That is
I would love to
so
see it.
funny. Oh, I
Yeah.
love that. Oh, doing it on your kiddos. I kind of just want to do it on Emmy for fun. I mean, she's 21 now. I mean, she knows all about it, but
Oh yeah,
it's like, let
probably
me
would be fun.
we
She'd
just
probably be
practice
fine.
on each other. Yeah, she'd be up for it. Well, recently we revisited that idea because, well, I still love a good spray tan, and I'm like, I would love it if it were just here.
Yeah,
But of course, if the room, it just doesn't make sense financially to offer that when you can
I
offer so
know.
many other things.
Right, right.
Oh, that is so funny. So thinking back to those days and when you were, starting, what were the surprises either in like something you thought would be really easy or great, an amazing treatment and it bombed, or something that you thought would never take off and it became, something huge?
Oh, that's a good question. Well, the first thing that came to mind, not necessarily a treatment, but I thought it was very interesting on everybody's way of creative payment, that they put a little bit here and a little bit there. I didn't really realize that was going to be an issue. So it's funny.
They're
Um,
still doing that.
Yes, yes, of course, that doesn't change. Cal, I think I mentioned earlier about filler, how that just changed so much over the last 20 years, and just, you did lips and nasolabial folds, and that's all you did. And then it just started, oh, and then you add the marionette lines, and then you add this. And so we feel blessed that we were able to kind of grow with that in terms of injectables. I think it's probably a little bit more challenging for new injectors to jump in, because it's like there's so many indications in different areas where you can put filler, which is great. Makes for a beautiful treatment, but there's just so much you learn like right away at once, where we just kind of every year, oh, now we can do this, and now we'll add that. And we sort of gradually learned it. So anyway, I think that's one thing. I think, I had high hopes for the BBL, but who knew it was going to
Mm.
be so huge? I mean, everybody needs BBL. So that I had not foreseen at all.
Well, I think especially since I started with the IPL and just watching the progression, kind of similar concept between filler and IPL to BBL, and how, I mean, you really had to be so careful early on not to
Oh,
stripe or burn
oh,
or blister
yeah,
or those things. And when the rep came in and said, "Oh, yeah, you can treat your Asian clients with BBL," and I was like, "No, I can't. I will never do that," you know?
great,
And then,
great.
yes, you can
Now we
safely.
can,
So,
yes.
yeah.
Yeah.
So back to filler, and it's so interesting that that is so true when you look at the steps and adding areas and different types of fillers and indications and things like that.
Mhm.
Because you're also a trainer, and so when whether it's one of your own team members or someone you're training, let's just talk about your team member since you've got so many touches with them. How do you approach that? Where do you start with? What type of product are you starting? Neurotoxin only? Do you start with neurotoxin and filler both? I mean, how do you approach that and bringing on a new team member?
Yeah, I think usually neurotoxin, but not very long, just neurotoxin, because fillers are so important. One place that's really nice to start is to have the new injectors do axillary Botox, or any kind of neurotoxin, because it gets them used to handling the needle and drawing things up, and the placement, if it's sort of off, their patients are still going to have results. So, and mainly, of course, they're doing it on staff when they first start out. So I would say neurotoxin first, and then we jump in with filler pretty quickly, because it's just such an important part of aesthetics. So, of course, they bring in their family and friends, and do training on them, and our staff is always volunteering as well. But probably after a week or two, I get them going on filler.
And when you start them on filler, are there certain areas that you'd like to start with that as well, similar to the neurotoxin?
Yeah, I think so. I mean, it seems like nasolabial folds would be easy, so sometimes I start with that, but even just doing cheeks is not too bad. I'll start with that. So I think both of those places are pretty good, pretty straightforward. I love injecting through a cannula, so that's pretty much what I train on. It's just I feel like it's safer to avoid any vascular events. And so I really teach all of my new injectors a cannula technique. And of course, there's times where you have to use a needle, but I think that just gives such beautiful results.
And just to give a little information, how many injectors do you have in your clinic?
Besides Mark and I, we have the two of us, and then we have three other injectors.
Three others.
Mhm.
What do you think just working with so many injectors over the years? Because I look so many are heavy on neurotoxin. 75% of what they inject sometimes will be neurotoxin. And And then, of course, even looking at our own team, and we have one of our nurse injectors who injects more filler than she does neurotoxin, but most of the time it's the other way around.
Yeah, yeah.
And so, why do you think that is? How could we help them get over that hump of going only 25% of what they're injecting is filler? How can we get them to the 40%, the 50% to get over that hump?
I think that's a
Hi, all. I hope you're enjoying the podcast. We are always looking for feedback to make it better. So be sure to give us your feedback at the link in the show notes. If you're loving the podcast, we would really appreciate it if you would share it with a friend, rate us 5 stars, and write a review. This really helps other clinics and industry professionals find our podcast. Thanks. Now let's get back to the episode. That hump.
I think that's a really, really good question. I think things that are helpful is holding the mirror to the patient and just saying, I think that this could be really, really pretty for you, and kind of go over it on the mirror. I know Mark uses a lot of, he does the before and after on the iPad and he'll show them. But I think just bringing up the subject is number one really, really important, because if you just throw out there, well, you're thinking about filler, uh, patients will say, oh no, I'm not old enough for that, or I'm not ready for that yet. And it's like, well, let's just kind of look in the mirror and let me show you what the possibilities are. So I think, first of all, in anything that we do as providers, we need to open our mouths and just say something. Don't ask if they need it, but just approach it that, I think this would be really pretty on you, and I think you should really think about this, or you know what, I've got a few extra minutes, we could just do it now. And then of course it makes them really nervous. No.
I'm the one that's like, yes, you can, let's do it.
Right, right. It'll be great. You're gonna love it. So I think that might be one thing, and I don't know. I mean, you have really seasoned injectors, so I don't think being afraid of doing filler is necessarily for that, on your injectors. But I think maybe some new injectors feel almost a little intimidated by it, and they're not sure, if it's going to turn out, or not sure exactly where to start. And I think that's really important when you're training injectors, is just to say, you kind of look at the whole face and see, just start with something, maybe they need a little cheek and they need a little lift, and just start there and mention that to them. So just find a place to start, and then they love the results. It's like, then we can go on, and this would be so nice, and let's do, a little Volux in the jawline, and you're gonna love that. And I think it's just starting somewhere. So
Well, I noticed also you all, when you were talking about Mark using the iPad, are you talking about the AI
not as
simulator?
much. We have
Okay.
that on our
Your
website, which
website?
I believe you probably do too. No, he just does. We do a lot of before and after pictures, pretty much on
Mhm.
the iPad, and then it just goes over into RX Photo. But he likes to, especially with new consults, do a photo first, because none of us like the way we look. And obviously, we've had a lot of patients that come in after these lovely Zoom calls and say, I need something. I look terrible on those calls. So when you see yourself as the world sees you, sometimes you think, oh, maybe I could do something a little better. So, yeah.
Yeah, I think the Zoom effect has definitely changed things for us.
Yes. Yes.
Um, okay, so just jumping into a couple things, I just want to say congratulations on your new clinic. You guys moved
Oh,
this summer, and I was stalking your Instagram earlier,
yeah.
and I hadn't seen it. I hadn't seen any of the photos or anything. So that was
Oh.
really fun to see the videos. And how was the move in?
It was good. It was good. We almost moved in on time. We just had the sinks were a little on back order, but um, yeah, it was really, actually, it was amazingly quick. We didn't want to interrupt our business. So Friday night, we had all the movers come in. and I was still seeing like my last patient, and I was working on the computer, and I looked behind me and they're whisking away all the computers and all the furniture, and they're like, can we take your computer? And I'm like, no, I'm still working. Oh, can we take your phone? I'm like, no, I have one more phone call, just wait. I looked around me and it was like a ghost town. I mean, they were just so fast. And then they took everything over to, our new clinic, which is really only about not even a half a mile away. And they had so many people just moving things in, and it was amazing. We were up and running for Monday. And
Wow. So why
yeah,
the move? Why did you move spaces?
multiple reasons. We had outgrown our space, and from the very beginning when we started, we had what I thought was a pretty big clinic, but probably about 12 years ago, we had expanded in that existing space because we were running out of room. And then now again, we thought, oh, this is huge, but we were running out of room again, and it was going to be a little convoluted to try to make it fit all in that particular space. And I think we were ready for kind of a fresher look, fresher start. I really like our new space now. The decor is totally different than what we had before, but it's updated, it's modern, it's light. The parking is fantastic for our patients, which I think is a big thing. We have our own door, whereas before we were in a medical building, and that gives you credibility, which is why I started there. But I think, over time we've built up our reputation where we don't necessarily need to be in a medical facility. And there's part medical and part non-medical in our building that we're in now. But I think we were just getting just so tight, and our assistants were all cramped into this one little room. And we were fighting over laser rooms and fighting over lasers. It's like, no, I need that room. No, 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 no. We've got this patient. They have to leave in a few minutes. And at that point, you're like, oh, it's really not working. And I remember when we first started and we wanted to expand, our financial advisor, he said, no, no, cramped is good. Just wait. Don't expand yet, because, it does affect your bottom line. So he kept saying, no, cramped is good. So we always think about, okay, we're going to wait until we're really cramped for space, and then we need to look for something else. So
Do you think that was, do you think that was good advice?
I do. I really do, to a certain extent. I mean, when you're on top of each other and you're fighting for rooms, that's not good. And I didn't like all of our assistants being in a little room. So yeah, what we have now is really, really nice, great flow, lots more room. Yeah, it's
Yeah, I think, we also kind of have a similar journey, but it is like you've got to get busy enough to justify it. So, I mean,
yeah.
I do think that that's good advice, but on the one hand, it's kind of like trying to figure out the timing sometimes can be difficult.
It can be, and it takes a while too, well, you've done this a few times too, from the time you think, well, we should do something else and explore the possibilities and then look for a different space. It's a long time. I mean, from the time we started looking at new spaces, it probably was a year and a half to finish our build out. So it takes time. And by that time, then you're like really squished.
Yep, yep. Ours took 2 years, so you beat us.
Oh, okay. Well,
So when you're building out your new space, there are so many clinics that we work with that are brand new in aesthetics. Here you have these 20 plus years of experience and purchase, getting into space and expanding in that space, and then moving to a new space. But so many of the people that I work with are brand new. What were like a couple of your must-haves as you're looking at your new space, whether it was like placement of the sink or the electrical outlets or size of treatment rooms or a room you thought you didn't need, but you really are so glad you have. I think you mentioned earlier, space for your assistants is so key. And that's something too with our new space. We have more windows as well, which our team loves. And the team space to have lunch has windows, which we didn't have that before.
right.
And I think that that is a game changer. Those little things, but it really does make a big impact.
It makes a big difference. I agree. I think one thing that's been really nice is we have kind of two different hallways in our well, we have lots of hallways, but where our laser techs, estheticians sit and where our assistants sit, is pretty much open. So there's a lot more camaraderie and sharing and talking. And, I think sometimes when you get a certain people in one room, it can get a little cliquey or just um, a little too tight. Whereas now it just seems like the atmosphere and our staff is just really happy and just has the flexibility to mingle a little bit. And I think that was one thing that I really wanted to do. I did not want closed off rooms for our staff. Well, except for the break room and some of their private spaces. So that was a must. One thing that we have, I don't know if you added this to your clinic or not, but we have 3 numbing rooms, which are really nice. They're not very big, but big enough for a nice comfy chair and a little TV, and we've got blankets. And that has done a couple things. One, I think it's really, really nice for our patients just to kind of be off on their own and they can do their own thing. But then also it's freed up a lot of our laser rooms, which we were prior to that in our old space, we were numbing in our laser rooms. So that was really taking a lot of time and hogging up rooms that could be more utilized for treatments. So I think that was really, really nice. I like that a lot.
So 3 numbing rooms, are they just single person use? So only
Yeah.
one client can be in there at a time?
Yes.
Interesting. And so how big are these rooms?
Oh, well, square footage wise, I don't know. They kind of are almost kind of like a large closet. I mean, they're
Okay,
not
but
that
that
big.
makes sense, like a
Yeah, I
comfortable
mean,
chair and a
yeah,
TV
just
and
have, enough for a nice reclining chair and a TV and a little table to, put your coffee on or whatever. Um, but that has really freed up a lot of space. And I think our patients really appreciate it too. And they're not just laying on the laser table getting numbed. So it doesn't take up a lot of space.
yeah,
They're
that's
not
really nice.
big.
Our numbing room is a bigger room with, you can seat maybe 8 people in it,
Uh-huh.
but then they're all together too. So, you have 2 to 3 or 4 people in there at the same time and but I mean, they're all numbing. And I will say
Right,
I've walked in there and they're making friends. Some of them
right,
start to chat and make friends,
right,
but
right.
it's, I kind of like that, like be able to go and relax in your own space and recline back and watch a show or not, something like that. That's really nice.
Yeah, so it's just how you want to utilize your space because we looked at the same thing that you're set up and just have one room for numbing. So we kind of entertained that idea for a while too. So I don't know what is better. I think it's probably kind of nice for patients to chit chat with each other and, oh, what do you do? I do this, and they could sell your treatments for you.
Well, one had just had a halo. We actually, now we're using it also for, when we use the Velez mask and they may stay for 30 minutes after the
Uh,
treatment. And so we'll just slip them right back into the numbing space.
yeah,
And one was numbing for Halo. The other one, I was removing the mask and the mask comes off. And she's like, the one that was numbing for Halo is like, oh my gosh, you look great. I am so relieved. Like that looks so much easier than
right.
I thought because, that Velez mask just cools and calms and
Yeah,
it really kind of cleans it up if you've got any pinpoint bleeding, it just pulls it off with it. And so,
I
it was kind of fun to see that response as
right,
well.
right. Yeah, the camaraderie there. Yeah.
Yeah, yeah. So in building your new space or maybe your old space and new space, I look at some of the things that we've gone through with our new space. We actually had a really cold winter and our pipes burst
Oh,
about 3 weeks
oh,
ago, and
oh
half the building was flooding through the ceiling.
terrible. I feel for you. I feel, oh, that is so awful. Oh my
I
God.
will say it was on the, office side, so at least it wasn't on the treatment side, so there's a
Yes,
silver lining.
yes, yes.
Um, but I think I was reading through some of yours. I mean, what about things like that have happened, at your clinic or, whether it's a team something with your team or something with the space or, any kind of like little missteps and just kind of getting through those.
Oh,
Um
yes. Well, we have lots of good stories. We had something similar happen to us. Mark and I were actually, we had just gotten out to Las Vegas for a conference. Luckily, neither one of us were speaking. And we got a call from the clinic and they said, we have some flooding going on. And it's like, well, what do you mean we're on the second floor?
Oh,
There was a dentist office above us, and
um,
I don't know, their water wasn't turned off, so it was leaking down. Luckily, none of our lasers were damaged, but again, a lot of papers in our office, and our staff was so great. They came in and they were cleaning things up, and oh, what a mess. And then we had in our other space sometimes too, it was an older building, so sometimes the plumbing wouldn't work quite right, and we had a couple leaks like down in our lobby, and now in our new space, we had just moved in and we have automatic doors on the very outside, and then we have like regular doors. And we had this rain windstorm, and it was interfering with the automatic doors, and it was just blowing like sideways right in, and we just had water all over. It's like, this is brand new. We can't have
ah,
this happen. So I mean, it's fixed, but the automatic door wasn't shutting because it said something was there, like all this rain.
oh,
So anyway, there's always adventures, and you just kind of have to laugh and ride through them.
oh, yeah, I can't agree with that more. Well, a few months in, summer hit and we all of a sudden had spiders.
Oh no. Oh
Yeah,
no.
that was great.
Uh-huh.
And so, it wasn't like an exterminator comes in once. It was months and months
Oh.
of,
Oh.
managing it. And as you can imagine, there are lots of people with true fear of spiders,
Oh yeah.
and so we really worked hard to get that managed and taken care of. But it's, I think there's just always things. And I love how you were just like, you just got to laugh. You just got to get through it. Cause like, what else can we control? I mean, the things are going to happen. It's just
Yeah.
having the attitude of getting through it. I think
Yeah.
one thing that I really noticed our manager does an amazing job of is she's really good at the relationships with the building maintenance crew. So when Do you know an outstanding med spa, doctor, manager, provider, or groundbreaking treatment that is reshaping the industry? Nominate them for Mint's Clinics to Watch. We are so excited to launch this initiative to recognize the true leaders in our industry. Our aim is to spotlight those leading the way to excellence, providing valuable insights for others to pave their path to success. Check out our website for past winners of the clinics to watch. You can also nominate someone at the link in our show notes. Share your nominations and be part of celebrating the industry leaders. Let's inspire and build success together. Being med spa owners and managers, we understand the constant demands on your plate. Let Mint's online e-courses lighten the load. Easily onboard new team members, manage course access, track user progress, and more, all at your fingertips. Our platform is tailored to alleviate training stress, providing your team with the education and support necessary to unlock their full potential as an aesthetic provider. Take a step towards seamless management and empowered teams. Learn more at mintaesthetics.com. We've got your back. Maintenance crew. So
The important.
when that flood hit, when it started coming through the lights, she was
Yeah.
on the phone, response right away. He was in here, he was on it, and I think that is just so important to remember as a management and owners to really nourish those relationships with the people that manage and maintain your building, because you're going to have these things. You've had
Yeah.
multiple floods,
Yes. We
right?
have.
And so it's like to have somebody that knows you because they care more, and they'll show up faster and they'll help you through it, and they come up with better ideas just by having those relationships. That's really, I mean, I watched her through this last one. I was like, wow, Tracy, you just really nailed that one in
That's a really,
in
really good
taking care
point.
of.
Yes, yes. How to win friends, right?
Yeah. Well, I have to say, I mean, that is totally your personality. And so I'm just wondering, have you always been that way? So outgoing, I mean, I think that from the moment I met you, I think I told you the story. recently. It was, years ago when Matt and I were first together and we were still distributing lasers for Sciton, and we
Uh-huh.
had a clinic here. And so we would cover, we covered a few states. This is back before Sciton had reps everywhere,
Yeah.
and employees of the company. And so I was doing a Saturday training and had brought in a couple of speakers, and one of the speakers was unable to come for personal reasons. And so Matt had had a relationship with you for a number of years, and Sciton had known you for many years. I think you're one of the first Sciton users,
Yeah.
I think, right?
Very early on.
Yes,
Very,
yes.
yeah.
And so it
2004.
was, yeah, it was like, give Beth a call. If she might be able to do it, and I called you and I was just panicked, and you just came right out. And I will never forget, you were dressed so elegantly. And we were out of chairs, and you're like, that's all right. I'll just sit back here on the floor until it's my turn. And I was like, no, but just so unassuming. And I thought, oh, wow, who is this woman? I really want to know her.
Uh,
And so I can't thank you enough for that. But I just think, you instantly connect with people. And I don't know, did that start at a young age? Have you developed that as, how do you see that in yourself?
People tell me that. I think, it's somewhat that I've had it. I mean, I think I love people, and um, I like to make sure that they feel comfortable. And I think it is something maybe over time that I've acquired too. Just as you live through life, you realize that there's times where you're put in situations, or where I'm put in a situation that I don't feel comfortable. So I don't want other people to feel like that, I guess. Yeah, I like people, and I like to talk to them, and it's a really good question. I think it's just the way I am. I don't know.
I love it. Well, I was just thinking, I think about that book and now movie, The Sliding Doors, often, getting on the train or not getting on the train. And if you get on the train, something happens. If you don't get on the train, something else happens.
Uh-huh.
And I'm just wondering, as you're thinking back through that, if there are any like sliding door moments
Mm. Well, let's
that you
see.
want to
I
share.
haven't seen the movie, but I know what you're talking about. Um, I think uh maybe a couple things. I think when we met Bob and Rob Brindley, when they were selling their Sciton, and that was sort of our first encounter with the laser. And that was we were very, very lucky and very, very fortunate that we got to meet them first before we looked at other lasers, because uh, we just love Sciton lasers, and they've performed really well for us. And I think, we could have maybe got introduced to a different laser company or a different laser, and maybe not had as much success. I know when I was first looking at building out our clinic, I talked to other physicians around the country, and what are good lasers and what do you do? And a lot of them were like, well, this one I have, but now it's kind of a coat rack, and this one is
Mm,
just in a different room. We're not using it. It's in a closet. And I thought, oh my, those are expensive mistakes.
right.
So and not to say that we haven't made mistakes, but that was a moment that I think we were just very, very fortunate that we got connected with really good company, and were able to um, utilize their knowledge and their lasers, and create really nice outcomes for our patients. So I think that was one moment. I think the other thing too, a long time ago, Mark and I were trying to get involved in kind of another business before we ever started this. And we read a lot of books, like How to Win Friends and Influence People, and The Power of Positive Thinking. And I remember before we started reading them, I'm like, why do people read these books? Can't they, figure it out for themselves? But that really, really helped going forward in our business. And I know there's a lot more books out there that get recommended. And I think really taking that knowledge and implementing it for yourself and sharing it with your staff. So both of our office managers that we've had in the past, we give them How to Win Friends and Influence People, the whole book, but we give it to them because there's just so many good little snippets in there to deal with people. And there's a lot of good books out there, but I think that we were just very fortunate that we came across some great books that helped us when we were starting our business.
Yeah, and I think to your point too with Robbie and I just it pops, it's like two amazing people,
Yeah,
I mean,
yeah.
and to see that their journey and to see Robbie where he is today is really fun.
It's really fun. I have to tell you a funny story if we have time for it. But when we were first starting our business, my mom was a member of this women's club, and they wanted me to do a talk. And we hadn't even really opened our practice yet. And I was supposed to do a PowerPoint. And I'm like, a PowerPoint, what is that? So Robbie comes over to our house and he's doing the PowerPoint, showing me how to do it. And I mean, he's practically just out of college,
Yeah.
he's just a newbie. But I've been so grateful for him because I mean, didn't really necessarily have anything to do with selling lasers, but he was totally willing. He just jumps in and helps me with PowerPoint and
I
yeah,
love that. I love
good
that.
memories. Yeah.
Oh, the best. So many good memories there.
Yeah.
So thinking about kind of what you've got going on now, what are you most excited about? Maybe a new treatment or something within your business or
Mm.
people or what is it that you wake up thinking, "Oh, I'm just so happy I've got this going on or this is happening in my life."
Yeah, I think number one, we talked about already the new clinic. It's just fun to go there. Our staff is just really energized and it's really fun to be with them. I think treatment wise, I think there's always new things coming out. I've been having a lot of fun with the new Skin Vive, the injections and putting it, kind of in areas that are off label. And it's just such a really nice add-on that you can do quickly. So I've really been enjoying that. And I think you probably do a lot of the PRP, PRF. I think that has also been a really nice procedure, and that's something that we've been doing. When did we start? Maybe about 6 months ago, 4 months ago, and that's been really fun. So I love new challenges, and I love bringing on new technology as long as it works. So it's fun to be able to offer something new that works to our patients.
And so what are the off-label areas for treating with Skin
Uh,
Vive? Or how are
well,
you using it? Like I mean, what areas are you using it? Who are you suggesting it for? What have you
yeah.
seen?
Well, I think anybody can benefit from it because, kind of makes that lake of hyaluronic acid under the skin and makes us glowy and everything is so smooth. So, FDA is recommended kind of for the lateral to mid cheek area. I am loving it periorally. I love it around the lips. So many of my patients that are a little bit elderly, they don't want their lips done, or they've said, I've had my lips done, a long time ago and it didn't look right. But to get in and just do the perioral lines, both upper and lower, I mean, right away you can see a difference and they're like, oh my gosh, this is great. Also, another good area is kind of the chin where people just have that, um, well, uh, more of a kind of pock chin and the skin is uneven there and it can really smooth that area out too. So, I mean, you can use it anywhere. We've been seeing some results with acne scarring. That's really nice. I hesitate a little bit because it doesn't last very long, but I'm kind of looking forward to doing more and more repeat patients because what I've heard from injectors in Canada that it gets better and better, not just acne scarring, but just in
Hmm.
general, the skin, even though it's kind of a 6-month indication, repeat patients just seem like it is additive for them.
That's exciting. We've been using it as well, but we've only had it for a few months. So be excited to see how that additive benefit works
Yeah,
here as well.
right, right.
Yeah. Yeah. I
So
had it and I was like, oh, I love it. I get it. Like,
yeah,
this is great. Yeah.
yeah, it's super nice. Yeah.
So when you look at your team and building a team over the last 20 years, 'cause you were talking about, one of the things that you love the most has like been opening your new clinic and having the space with your team. What are some key pieces to building that team and creating a culture where people are so happy and they stay? What
Mhm.
have you found to be the most important pieces?
Hmm. Well, I think one thing when we're interviewing for staff, and I'm sure you share this philosophy, is that I want to hire somebody that makes me feel good, somebody that is kind and respectful, because that's something that you can't necessarily teach, but you can hopefully teach most people on how to do the computer and how to answer the phone. But if they don't have basic respect and kindness, you can't teach that. So there is something to be said for if you sit down with somebody and right away you're just like, oh, this person makes me feel good. I really like them. I think that they are a good possibility to hire. Have I burned on that? Maybe once or twice, but that's over a long period of time. So I think hiring the personality is one of the key things, because a lot of the other things you can train and teach, um, and that prevents, if you have the basic respect for each other, prevents a lot of drama from going on, and um, we don't need drama in the workplace.
No, we're here all the time.
Right.
We better enjoy it. Well,
Exactly.
I was talking with a group of clinics recently, and um, we were talking about something very similar. And a comment was made that, if you've got this culture like you and Mark have of, this beautiful clinic, these amazing people, you're enjoying it there, they're enjoying it there. I'm assuming you also get resumes that come in because the industry is small and word of mouth is fast. And
Mhm.
so when you have an open spot, it's probably pretty easy to fill that because the reps will say, "Oh my gosh, yes, you absolutely want to work there," you
Right.
know? And so within this conversation, another comment was if your clinic does not have a good culture, if you don't have that cleaned up first, then you don't get the same level of resumes. And so it's hard to find those great personalities to start with, the people that are respectful to start with, the people that they may not have the training of injectables, they may not have the training of skincare yet, they may not have those things, but they have the fundamentals of like just being a good human and wanting to be there. And and I thought that's so interesting. I'd really hadn't thought about that before. And so it's like I thought, it's really so much about creating this culture first so that it draws these people in, and then you get a
Mm.
higher level of resumes to draw from, and
Yeah,
so it
very
makes it a little.
interesting. Yeah, one of I think one of the highest compliments is when patients come in and everybody's been nice to them. They're like, "Oh, I would love to work here. This would be such a great place to work." I'm like, "Oh, that's nice."
Yeah, it's so great. Or, "Oh my gosh, my niece is about to finish school. I really want her come in. Could she just come and shadow? Could
Right,
you help
right.
her with the interview process?" Those types of things. And I love that as well.
It's a high
Um,
compliment. Yeah.
yes. So is there anything in the industry that you see coming out, or that you're really excited about? Any new technology that you haven't quite
Ooh.
got your hands on yet, or a new procedure?
Not so much. I think that what we're seeing a lot more in the industry is maybe more health and wellness, IV injectables, weight loss, that kind of thing. We haven't really implemented that too much, but kind of looking at that and thinking about that. Um, but not too much that I'm aware of, I guess, in other areas. How about you? Is there something that you guys have your eye on?
Well, I'm just curious. We have been looking at the wellness piece, and we do offer bioidentical hormones now through our wellness program, which is, and it's actually not aesthetic hair. It's Dr. Amy Carter, but we're in the
Yeah,
same space and we refer
sure.
back to each other.
Right.
But she is doing the bioidentical hormones as well as the weight loss shots, and we're working towards setting up the IVs, which I personally am really excited about. Um, and so, but I think I'm just curious as to what's holding you back with that. And, yeah, kind of starting there. What do you think
No,
about that
that's
as you've looked at?
yeah, that's a really good question. I think because it's different, because it's really different than our little area where we're concerned about skin, we're concerned about fine lines and wrinkles. It's just sort of a different path in a way, because Mark has been doing laser assisted liposuction for a long time, so and Cool Sculpt. and liquid lipo we do. So, you know, body image and fat reduction in a way is part of what we do. So I think it's just getting your head around being maybe our clinic being a little different model than it was, you know, back in the day. And I think that we all have to be aware of what's going on around us in terms of changing and what patients and the population would like, as long as it's safe for them. Um, and and things change and demands change, and if there's a need for it and it's a good treatment and it actually works, then I think we can pursue it. So I am looking at kind of changing how we look at things and operate now with the new space. You know, now we have probably room to do some of those other treatments too. So, but I guess I'm not always the first one on the boat for things, just to make sure that it's working out all right.
I don't blame you.
But I am, but we are really looking at bringing on some of those things. We've actually had some conversations about it just in the last couple of weeks. So, but good question. Yeah.
Yeah, I was just curious. We've seen some really amazing benefits for our clients, our team, and so it really excites me because they're so happy. I do wonder, and I think it contributes to there's a decrease in cool sculpting treatments. And so, I'm not sure how much of that contributes to it, but we have seen that, which is, great. Like we want our clients to find the right path for them. And
Mhm.
so if they are, ready for that, for the weight loss program, I mean, it's truly miraculous what's happened there. And then eventually, there might be, it's probably a better place to start with cool sculpting when they're almost to their ideal weight and it's one little area
Right.
versus
Right.
more than that. So I think
Right.
that there's some synergy that we're still working to create there, but that I think will be really big.
Yeah, no, that's a good point. And I think with cool sculpting, you know, it started out as, well, you just do one area and you're going to have these great results. And then it's like, well, no, you need multiple treatments. And so that becomes a little bit bigger undertaking for patients financially. Whereas, like you said, I think that's a really good idea. If you kind of get them to more their ideal weight and just do a little sculpting, is probably much more reasonable, to do the cool sculpting for patients.
Definitely. So just a couple of personal questions. I'll let you go.
This is fun. I like talking to you.
I mean, what are you doing when you're not at work? What I
Uh,
mean, it's like, what are you really passionate about outside of the clinic? I mean, I'm sure this is very consuming knowing the business and how it runs, but what do you
yeah,
love to do
it,
outside of the clinic?
it is consuming. I love to read and I love to exercise. So those are the two things that I like to take time to do besides, you know, being with our family. But my kids are all young adults now, so they're kind of coming and going, and you just have to get the snatches with them when you can. But yeah, I like to bike ride and just get out there and be busy. I love to be outside.
What's your favorite exercise right now? Is it the bike riding?
Yeah, yeah, it
Yeah.
is. Yeah, I like it a lot.
Are your kids visiting you in Florida?
You heard about that. Yes,
How's
yes,
that
they
warm weather
are.
place you now have? I bet
Yeah.
they're real excited to go there.
Yes, they are, and I love bike riding down there. Yes, they've all been there. They were down there at Christmas, and our daughter, who's our oldest, she's like, "Carl, I think I'm going to get a job down in Florida," because she's in between jobs. And I'm like, "Okay, where are you going to stay?"
Well, I know a place. Yeah.
Yeah, I think she does too.
Yeah. Well, I mean, I do think about that often in looking at a place, not necessarily, just a second home for us in the future and a place that our kids will want to come. Cause I
Yes,
mean, that's just
yes,
that's as they get older and as we have a 21-year-old, but we also have an 8-year-old,
right,
it's like we want them to love a place so that they're always wanting to visit us. So
right.
I think the Florida idea is a really good one.
So far, so good.
Oh, well, thank you so much for being on with me
Oh,
today.
thank you.
I Oh, I just adore you. I wanted to, we do a little thing here. It's the Mint Minute where we take a minute to share one little tip or one little thing whether it's your favorite product or a management tool or the AI simulator or anything like that. Do you have a little minute you want to share?
Good question. You know,
If you're looking for a management and marketing training for your med spa, head to Kansas City with Mint Aesthetics. Join us on May 7th and 8th for an immersive 2-day hands-on training session led by the management team of a $14 million med spa thriving for over 20 years. Discover the processes that propelled our success and learn how to adapt them to your business. This collaborative environment provides a unique opportunity to share successes, ask growth-oriented questions, and gain insights from our own missteps. Engage with Aesthetic Care owner Matt Toronto on company culture and customer service. Dive into the marketing strategies behind our annual open house, our biggest revenue-generating event of the year. Even talk with our clinic manager about the intricacies of hiring and training for the highest level of customer service. Our entire management and marketing team will be at your disposal for a comprehensive exchange of ideas, insights, and effective initiatives for your clinic. Don't miss out. Use the link in our show notes to learn more about this event or secure your spot today. Do you know an outstanding med spa, doctor, manager, provider, or groundbreaking treatment that is reshaping the industry? Nominate them for Mint's Clinics to Watch. We are so excited to launch this initiative to recognize the true leaders in our industry. Our aim is to spotlight those leading the way to excellence, providing valuable insights for others to pave their path to success. Check out our website for past winners of the Clinics to Watch. You can also nominate someone at the link in our show notes. Share your nominations and be part of celebrating the industry leaders. Let's inspire and build success together.
I think I kind of touched on a few things, the Skin Vive for one, and using cannulas. That's just my favorite thing to inject with cannulas. I think those would be my Mint minute.
Those are perfect minutes. I'm a big fan of both of those. So,
good.
Well, thank you so much, Dr. Hagberg. Just really enjoyed having you on today. I can't thank you enough for spending the time to get on and doing this with us and just sharing your valuable information with all of our Mint listeners. So soak it up today, Mint listeners. Dr. Hagberg on with us. She's just amazing. And we'll, of course, put her links to website, social media down below. So make sure you check that out and follow her to see all the beautiful things that she's doing at her clinic. And we'll see you at the next episode. Thanks for listening.
Bye, Kathy.
Thanks for tuning in to today's episode of the Making of a Multi-Million-Dollar Med Spa podcast. I'm Kat Toronto, and it's been an absolute joy to be part of your journey. Until next time, let your passion lead the way. See you soon.